So yeah, have a rest. So in the hamstrings, I can palpate the gracilis here. The gracilis is very easy to palpate, to detect, because it's very cylindric and fibrous. So I just put my fingers like this and I can feel it. So if I move here, I'm just in the posterior surface of gracilis. So from here to here, I'm going to have all the hamstrings. Remember, the anatomy says that we have vastus lateralis here, and the vastus lateralis has the surface with the biceps, long head and short head. So remember that the tensor fascia lata is not having a direct surface with biceps. It's just superficially to the vastus lateralis. So we have vastus lateralis, which is having surface with rectus femoris and biceps femoris, but fascia lata is superficial, like this. So sometimes we feel like a small surface, but at both sides they are with the vastus lateralis. So if I feel a big surface like this will be between vastus lateralis and, in this case, long head of biceps. So where I'm going to find the trigger points? If you have a look to the charts, we are always going to find more or less in the mid part, okay? Because muscle belly is going from this insertion to here. So more or less this is the mid part. But this is going to be the mid part for long head of biceps, so we can palpate like this, more or less here, or the part of semimembranosus, also here. So what's happening, for example, with the short head of biceps?
Distal.
Okay, we will find it a bit more distal, because if it's starting here and going here, usually we are going to palpate more or less in this area. Sometimes a good reference is that when you are palpating, you find like a gap, or sometimes you can flex this even a little, so you feel there is like a hole where the short head is starting. Okay, so this can be a reference, but anyway, what we are going to do for trigger points is to palpate in the mid part and then also move to this part. Usually the long heads are going to be much more affected, or semimembranosus, I'm going to this area. What is happening with the semitendinosus? How do you imagine from an anatomical point of view?
It's in the middle between biceps and the semimembranosus.
There is only one surcus. This big surcus between biceps and semimembranosus is covered by the sciatic nerve. Okay, so the semitendinosus, we have the insertion, we have here semitendinosus and semimembranosus like this, and biceps, but then semitendinosus, which is just close to this, is getting a tendon and is getting superficial to semimembranosus. So if you have a look here, this tendon will be the semitendinosus. So you can follow this tendon until more or less here. So if the muscle belly is usually in this part, we are going to find trigger points. They will look like very high, but this is because this is the area. Okay, so for semitendinosus we are going to look here, for semimembranosus in this area, and for biceps here, or the short head more or less here. Okay, so when you are palpating, you will find a very big surcus between biceps and semimembranosus. So if you put your fingers like this, you will feel a very, very big surcus. So this is the place you are going to avoid with the needle. So when we are doing biceps, we have to avoid getting to the sciatic, or when we are doing semimembranosus, we have to avoid it. So this means that, for example, when we are palpating like this, if I find a trigger point very close to this area, I will have to be like very perpendicular with a lot of caution, or sometimes we say to give a bit of inclination of safety, getting away. Because if we use a needle of 4 or 5 or 6, when it's very deep, if I have this inclination, it's going to be to the sciatic nerve. Okay, so then I try to use this or a bit like this. But what happens if I'm palpating here in the mid part? Perhaps there won't be so many problems because I'm much more lateral. But if you give a lot of inclination, it can be a problem. So if I palpate and more or less the plane is this, more or less you have to take care of not going to the sciatic nerve. So sometimes you can adjust a little or just check everything is going well. If you remember with the ultrasound, despite we were seeing the sciatic nerve, we got some electrical activity. So the best thing is just to check and to feel that this direction is free. Okay? So regarding the semimembranosus, this is mainly the same. If we are like this, we are going to palpate. So if we palpate this dot band, the direction would be this. Possibly we won't have any problem. But if we are palpating here, if we give some inclination like this, we are going to hit the sciatic. Okay, so we always give a safety inclination like this to avoid, or if we are here, like this. But this is just 15 degrees, just very gentle, because if not, which is the problem? You are going not to cover the deepest part of the muscle. So well, you don't reach the sciatic nerve, but you don't reach the trigger point, so this is the idea. So one muscle which is very difficult to do the knee is semitendinosus, because this is very thin. So when you are palpating here, you will find a very big surface, but if you move here a bit up, there is a part where if you move, you will feel like a muscle of this weight and then a small surface. So here in the upper part you can feel a small surface between semimembranosus and semitendinosus, but as long as you are going a bit down, you are loosening. Okay, you are losing the surface. So for example here I can feel it very well, perhaps you feel it, okay? But if I move here, this muscle, which is like also very fibrous, this is semitendinosus, so if I move a bit more here, there is another surface. So from this point, so this is the area for semitendinosus. This is very short area, okay?
Only this area.
This one, between these two, I'm going to say. So semitendinosus is like this. I'm palpating a big surface here and a small surface here. So this is a very reduced area. So what I have to do is to palpate like this and then to compress and go just perpendicular. Okay? Anyway, you have to be checking also the sciatic nerve, but the problem is that this is very there is a very short area to access semitendinosus. So what I'm going to do to check semitendinosus is to have a look in all this area. So for example, in this case, I'm finding a bit more here. I don't know if you feel more here or not, or here perhaps. Both of that. This is a good point, I think. Do you feel any difference?
Yes.
This is worse or not?
Up and down.
This one?
Yeah.
Okay, so we can choose this. Well, we can do, if you want, one of them or two, because we are not going to do a lot of kneeling for
Which
him.
one is the most effective? Always have trigger point.
Well, usually semitendinosus and semimembranosus usually have trigger points, or even the long head. So
Okay.
it depends. We usually find in all the long heads. Okay. So in the short head we are not having so much. Okay. We can also teach you some exercise also for the eccentric exercise of the hamstrings. Okay. So we will tell a very simple exercise. So for example, we can do the semitendinosus, and if you want, we can do some here in semimembranosus or biceps. Okay. So. Which is the needle I'm going to use? What do you think?
4.
4 or 5 more or less. Okay? No, they won't. For example, for here, perhaps with 4 it's enough. Here, perhaps if I give some inclination, I can take 5. Okay? So I'm going to start here. Okay, I'm going to palpate. You just tell me if I'm finding the trigger point. This is circus, so I move from the circus. I feel it very well. So here there is a bit of nodule. How do you feel this? A bit upper? This is fine for me. Perhaps this? This one? Okay. So in this case, I'm falling here to a circus, going over the semitendinosus and falling to a circus, so I'm going to compress. So I'm going to make a first insertion very quietly, very slow. Tell me if everything is fine. Pain? Or electricity? Pain? Is it okay? Okay, so I have found some resistance and some pain, just very superficial when starting. So what I can do is, instead of going very deep, I can go to the superficial and move just here, superficial, okay? Do you feel it? Okay, so we can do like this. So another thing we are doing is always to test where I'm finding resistance, or if through this we are getting some local tissue responses. Did you realize of it in the gluteus, for example, that when you were inserting the long needle, for example, in the centimeter 2 or 4 or 5, you were getting resistance and then releasing, resistance, releasing. So sometimes you have to be specific, although sometimes if you find a lot of trigger points, when we're joking, like playing the violin, something like that. Okay, so sometimes you are like playing the violin with a big needle because you find a lot of trigger points. Okay, so for example, we can do one in semimembranosus or semitendinosus or or biceps. So tell me if you have more tension here or here. For example, here I think it's tense. Okay.
What is the trigger point?
Then I think go. So for example, we are going to do one in the semimembranosus. So I'm going to palpate mainly in this area. So for me this is tense but not nodular. So for example here, this is very nodular, okay? This is fine. So here I feel a clear nodule. Do you feel this more sensitive? Okay. So in this case, which is my palpation? I'm palpating like this. I'm moving over the trigger point, so I'm going to compress. So my plane is this. So if my plane is this, more or less, I should be like this. Do you agree? Because what I want to do is to go deeper, following more or less the plane of compression, because I don't know if it's just very superficial or we can find some other deeper. Okay? So I do it very slow. It's okay? Okay. So I'm going to do a bit here. Do you feel some twitch? Here? Okay. Well, we are not going to do more. So sometimes the idea that you may have when doing dry milling here would be being convergent to the femur, okay? But sometimes this is very deep because you are also inclining the needle. But this is like in the gluteus that you have the reference to be convergent to the bone. So this is mainly the idea. So if you are here and you are moving here or here, this is mainly convergent to the bone, okay? Well, we are going to have a look to the leg muscles.
Do you want to change?
Oh, yeah. Do you want to change and I repeat something?